When talking about the core and the pelvic floor, we really have to think about what's happening with the abdominal wall as well. And during pregnancy, this section, especially of the abdomen, gets very challenged. Of course, the whole body gets challenged, but this is where the bulk of the stretch takes place. And so we have 3 layers to the abdominal wall. The most superficial is our rectus abdominis, our 6-pack crunchy muscle. It connects to the bottom of our ribs and to the top of the tailbone, and the fibers run vertically this way. Then we have our internal and external obliques that run on a diagonal from the outside to the inside, inside to the outside. And then our deepest layer of the abdominal wall is called the transversus. It is the transversus that is part of our core and should work in a coordinated effort with our diaphragm, pelvic floor, and multifidus. So especially because all segments of our abdominal wall get stretched here, we really want to focus on the transversus just to maintain its coordination as best we can throughout pregnancy, as it will continue to stretch until birth, but also to help support the abdominal wall as best we can to offload potentially the work that the pelvic floor is doing. So if we think about the abdominal wall here, and the transversus fibers run horizontally like this. Again, they attach from the pubic bone to the ribs and the spine at the back, wrapping all the way around like a corset. So these deep muscles have 3 segments. We have a lower segment, a mid segment around the level of our navel, and an upper segment around the top, around the bottom of the ribs, top of the abdomen. And so we'll focus first on the lower segment because they're more superficial and we can feel them a little bit better here. So with our pelvic floor activation and with our exhale, all of these muscles should reflexively connect and give our middle a little bit of a hug. So a lot of the time, the cueing we hear for connecting to transversus is navel to spine. However, there's many different ways you can compensate, including sucking in your breath to draw navel to spine, which is not a true transversus activation. It's more of a pressurization from the diaphragm and the abdominal wall. So to truly connect to the lower segment of the transversus, I will get you to think about having a string connecting your 2 hip bones here at the front. These little bony bits here. So that string connecting your 2 hip bones here at the front. Gently, on the exhale, I will get you to think about drawing those hip bones towards center or drawing the string towards midline. So you can place your hands on your lower belly, and let's just tune into the breath for a moment. So take a nice breath into your rib cage like we've done before. On the exhale, don't do anything except notice what happens to your belly as you deflate. So 2 more breaths there. Inhale. Exhale, let it go. Last one. And deflate. So hopefully what you should notice is as you breathe in, as we did before, ribcage expands, belly and chest come along for the ride, everything inflates on the inhale. On the exhale, your belly should recoil reflexively without doing anything at all and drawing in towards your center, giving your middle a little bit of a hug. Connecting to transversus, we'll coordinate again with the breath on the exhale. And instead of thinking about connecting the pelvic floor, we'll focus on the lower abdomen. So bring your hands just inside the bony parts of your pelvis, or you can bring your fingertips just inside the bony parts here. Again, imagine that string connecting your 2 hip bones towards center. Just take a nice breath in, expand the back sides of the ribs. Exhale, think about flickering a flame, and then think about gently drawing hip bones towards center this way. So it's not a front-back connection, it's a side-to-side connection. Inhale, expand the ribs again. Exhale, ride the wave of your deflation and accentuate it by connecting your hip bones to center. Another way to think about connecting transversus would be to imagine your pelvis like an open book. So the spine of the book, if I'm showing you the pictures this way, would be the spine, your spine here, and the heel of my hands. Your hip bones at the front here would be my fingertips and would be the edges of the book cover. So on the exhale, you can imagine gently closing your pelvis like a book this way. So take a nice breath in, expand the ribs. On the exhale, connect your hip bones through center. We're closing the book of your pelvis this way. Inhale, let it go, expand the ribs. Exhale, close the book of your pelvis. So similar to the pelvic floor, This muscle activation should feel more of like a subtle tension. And again, the muscle fibers run horizontally this way. So if you can imagine the cross bridges of the muscle fibers doing this, then that can be helpful as well. So what you'll feel is a subtle tension under your fingertips, and then also a little bit of a hug towards your middle. You may also get a little rise in the belly, which is great. But again, the focus should be more right to left towards center. You can use this anytime, especially when you're doing any abdominal work or core work, thinking about connecting to transversus first and then moving. Or even if you're going to lift a toddler or lift your new baby, you can exhale at a minimum, and then seeing if you can also add on the little gentle connection right to left or closing the book of your pelvis.